Yeah. Hi students. In this video, we will see the oral contraceptives. And I am Dr. Badrinath. Oral contraceptives. That is today's video's topic. We know that very well. Contraceptives are the substances or the devices which prevents the pregnancy. Prevents the pregnancy. Prevents the birth. Okay, that is called as a contraceptives, right? And nowadays these contraceptives are essential because the world population is increasing like anything. You see here, overpopulation, what a huge population. If it is growing like that, even the globe is not sufficient to place the humans. See how they are, see this person is falling down. Actually, if you fell, you will fall on the earth, but this person is falling from the earth. Just see, so it is very risky falling from the earth. See how they are catching the each other. No place at all here on the earth. See, earth is crying. Actually, the corona is very good for earth. In the angle of earth, it is very good because it reduces the population. It has to come. Otherwise, it is very difficult. Okay, from that angle, it is correct. Okay, from the earth, because the burden on the earth is reduced. See how the huge number. Huge. There is no place even for sand also. If I put a sand on them, it doesn't fall on the earth. Sand. That much of huge population. See, very massive. Very massive. Huge. All the needs we have to all the needs of the humans the government has to take care. No, it is very difficult for government also, because maintenance of such a big population, it is not. Yeah. Contraceptive, if you see the definition, contraceptives are nothing but either a chemical or hormones or a synthetic preparation, natural preparation, or it is a plant source, whatever it may be. Any substance, it is nothing but a substance or it is a device. Here you can see either it is a device or it is a substance whose main purpose is to prevent a woman from becoming a pregnant. That is the main definition of the contraceptive. Women cannot become a pregnant. Okay. See, there is a number of contraceptive methods are there. See, this is a male condom. Okay, female condom. This is the oral contraceptive tablets, hormonal tablets. Non-hormonal is also there. Oral contraceptive. This is our today's topic. Oral contraceptive. Not all contraceptives. No. In your syllabus, they have given only oral contraceptive. So that's why I am focusing on the only oral contraceptive. This is the hormonal ring, also called as a vaginal ring. It consists of a hormones and UID. This is placed in the uterus. That is our birthplace from where we born. That is a UID, uterine place T-shape. And here you can see this is the injection, contraceptive injection. This is surgical removal of the fetus or baby. That is also okay. Implants, it consists of a hormones which is inserted into that, like that. Coitus interruption, like following a time or following a calendar. This is a douche. It washes the vaginal douche, and it is a contraceptive patch. Hormone is available in the form of a patch. Okay, and here you can see it is a diaphragm. That is a vaginal cap also. It is also called like that. Okay, like that. So many methods are there. Our today's topic is only concentrated on the oral contraceptive which are used orally. That is a today's heading. This is the see. This is your syllabus, and the point what I have highlighted here, oral contraceptive. That is our today's topic. Yeah, here you can see oral route. That's why I highlighted with the oral. Oral you are taking only, the remaining and all we are not at all bothering about that. That I will make in a separate videos if you want. That is another part. Orally you are taking a medicine or substance or hormone, whatever it may be. It prevents the pregnancy. Is called as a oral contraceptives. Yeah. Mainly two types are there. Oral contraceptives. One is a hormonal, non-hormonal. If you see the hormonal, name itself indicate it consists of the hormones. Whereas here It contains no hormones. No hormones. It is a hormones are nothing but a steroidal molecule. That's why it is also called as a steroidal molecules. Whereas here it is a non-steroidal molecule. If you see the example, popular example, estrogen, progesterone. If you are taking in excess dose, excess you have to take. See, progesterone favors the pregnancy. If you are taking in a excess, it terminates the pregnancy. That point you have to keep in your mind. Estrogen, progesterone, hormones, very simple hormones. Here you can see Centchroman. Scent, you can remember, scent will spray, no scent. Man, M-A-N, man, like that you can remember. Chrome means color. Color scent to a man, like that is Centchroman man. It is also called as a Ormeloxifene or Milo, or Milo, like that. Ormeloxifene. First, we will see non-hormonal. Only one very small one drug is there. That's the most important. Centchroman, also called as a Ormeloxifene. That is the only non-hormonal that we will see first. This is the Centchroman. Here you can see this is here. See my cursor. Centchroman tablets. Are able to see as per the IP. Okay, this is also called as a Ormeloxifene. It is available in the name of the Saheli. It is a government branded drug. This is, that's why I symbolized here the government symbol. It is a white strip available, transparent strip. Okay, aluminum foil backside. It is a oral tablets is there. The twice a week for first 3 months. This is the dose. Here 8 tablets are available. You have to purchase twice a week, 2 a week. See here, these 2 per a week. For first 3 months they have to use per week. Okay, this is called as a Saheli. In the examination also, in IAS IPS examination also, they asked what is a government officially released tablet for the control of a birth or as a contraceptive. It is a Saheli brand name. It consists of a chemical Centchroman Ormeloxifene. It is a non-steroidal because we have studied under the, see here, Centchroman comes under the non-hormonal, non-steroidal. It is a oral route because we are studying only oral contraceptives. Okay. And what are the specialties? If you see, it is developed by the CDRI, Central Drug Research Institution, which is located in the Lucknow, that is Uttar Pradesh. Officially, they discovered this chemical, and officially they are preparing on behalf of the government. Very cheaply they will give, very cheap, nominal rate 5 paisa, 10 paisa, they will give the tablets. Freely also they will give, because they have to control the population rate in the India. Trade name is Saheli. Advantages, main 2 advantages are there. Menstrual cycle remains normal. Okay, there is no disturbance in the menstrual cycle. That is the main biggest advantage of this. And also, if you stop taking a tablet, reversibility is there. Reversibly, again, if you want a pregnancy, just you stop the using of it. So it always you will become a pregnancy. Okay, completely reversibility after withdrawal. Okay, after withdrawal. And here you can see the take twice a week dosage, twice a week on a fixed days, 2 days per week. Okay, on fixed days. For example, say Monday and Friday, 2 days fixed. They have to select. First 3 months they have to take like that, followed by a once a week thereafter. Safe for breastfeeding women. It is also safe. That is also one of the advantages also there. Okay, breastfeeding mother, if she want the stop the contraceptive for further pregnancy and all, they can use it. See, this is reversible method. Irreversibility, what I have shown, surgical method, tubectomy, vasectomy. In my first slide, I told, no, tubectomy, vasectomy, it avoids the pregnancy. And Centchroman mechanism of action suppresses the corpus luteal function. Here you can find the corpus luteum in the ovary. Ovary consists of corpus luteum. Okay, so when there was a suppression of this corpus luteum function, ovum will not be developed. That is point you have to, ovum will not be developed at all. Interfere with the motility of the fallopian tube. This is a fallopian tube. This tube motility will be changed like this. Motility will be changed. So egg will not reach properly to the uterus. Asynchrony between, there is no, actually there is a synchrony, just like a harmony, just like here synchrony is there between the ovulation and development of a uterus lining. This is a uterus lining. Here see the cursor pointer. This is uterus lining. Rhythm is there between the ovulation and development of a this one layer, that both asynchronized. See one the coordination between the these two will be breakdown coordination, and it speeds the transport of egg through the fallopian tube. So egg becomes very fastly it comes. By the time here there is no layer, so that egg will not be implanted. Okay, implantation is not possible because the ovum which is released, even ovum will not be released by if you are using this tablet. But even though in some cases if the ovum is released, it comes very fast. So by the time here the layer will not be formed. Okay, so that implantation is not possible. And as you can see the Pearl index, I will explain you what is this Pearl index. It is the most common technique used in the clinical trials for reporting the effectiveness of a birth control. Okay, how to control the high Pearl index, ineffective contraceptive method, ineffective pregnancy. Okay, high Pearl index. If Pearl index is high, don't get confusion. If see here, no method. Pearl index is high, no contraceptive method. This point you have to keep in your mind. No contraceptive method. Birth rate is good. Pearl index is 80, so it is very poor. Okay, like that. This is the Pearl index formula, and here you can see male condoms having a very less Pearl index. That is means it is a good for very good contraceptive. It must be low. High Pearl index means ineffective contraceptive method. That is a correct sentence. Okay, see here, and if you come to the OCP, see OCP, oral contraceptive method, Centchroman, see the Centchroman or Saheli, average is 2 I have mentioned. It should be less. Okay, as less as possible your Pearl index, that is good method. Like that, good contraceptive method, like that you can do. Less Pearl index, good contraceptive method. High Pearl index, ineffective contraceptive method. Pearl means here you can see how the pearl is formed in the shell, like that. Pearl index they are indicating, like a uterus in the baby, like that they will feel. Steroidal, that is a hormonal oral contraceptive pills, recommended mainly in the women of younger age group up to 35 years they can use. After 35 years you can use another methods, not this method. This is the mechanism of action. Synthetic preparation of estrogens synthesized in the laboratory. Progesterone, estrogen, they will synthesize in the laboratory and you have to take in the form of a tablet. When you are taking orally excess level, hormonal levels will be raised in our body. See here. Negative feedback mechanism, whenever there was a excess amount of the hormone in the body, it gives a signals to anterior pituitary gland to stop the FSH and LH, follicular stimulating hormone, luteinizing hormone. So if there is no such a FSH and LH, automatically ovulation will be stopped. Yeah, there is a oral contraceptive, or mainly that is tablets or pills we are calling as a small quantity pill. Some big quantity means you can say it is a tablet. Pills are nothing but a small tablets. Then you can say use the word of pill. Types, combined pill. These are very, very important. Combined pill, sequential pill, mini pill, post-coital pill. Morning, this is also called as a morning pill. All these are the pills, hormones only. Non-hormonal, I have already told, it is a Saheli. Centchroman. It is the only drug, only tablet, non-hormonal. See, whenever you are using a hormone, that's why here you can see, keep this image. Balance is very important. Balance, how much amount of the hormone you are giving. If you are giving some extra quantity of the hormone, it may leads to cancer also. That's why you have to give some little bit extra, like the balance is important. See, that is very, very important. Otherwise, various specific problems will be there. First, we will see combined pill. Why the name they are calling as a combined pill? It contains the both estrogen in the form of ethyl estradiol or menstranol, 20 to 50 mg of estrogen. Okay, this is synthetically estrogen, ethyl estradiol or menstranol. Progesterone, nor northestrone, norgestrol. You can use any one. Okay, progesterone. It is in the dose of the 0.5 to 2 mg. This is a small. Progesterone they are using a small, and estrogen is a big. Availability, it is available in the form of like this. Mala N, Mala D. I will explain. Mala N is a 21 tablets. Mala D, it is a government preparation. These are also government preparation, hormonal. Saheli is a government preparation, non-hormonal. That point you have to keep in your mind. And this is a tablet. It is available like this, combined pills. See, start in the green section. In this green section, you can start at any day. For example, today is Wednesday. You start here. Okay, here see Wednesday. You start here. Daily you have to take one like this arrow mark. See the arrow mark, you follow like this, and here like this. Okay, and like daily one tablet. Okay, and finally you have to complete up to the Tuesday because you started on Wednesday. Okay, today is Wednesday, like that. So it ends here like this. This is the arrow marks how you are taking. Mala N, Mala D also very popular. Mala N consists of a 21 tablets. See here, this is a Mala N. This is a Mala D. It is a 21 tablets like this. See here, you can see 7 tablets in a row, like 7 into 3. Only white color tablets are here, Mala N. Whereas a Mala D, it consists of a black color tablets also. 1, 2, 3, 4, 5, 6, 7. It consists of a ferrous fumarate. These 7 tablets doesn't consist of a hormones. It consists of only the ferrous fumarate or ferrous sulfate. See here, ferrous sulfate. Because iron is very important, because during the menstruation, women loses the blood. They want to recover the blood, reproduce the blood. For that, they require the iron. So government has planned in such a way that 7 tablets are in a row. Why they have to put empty the alien? Daily, they let them daily take 7 days. You keep the ferrous fumarate tablet so that blood will be recovered. Here you can see the difference. Mala N. Norgestrol. This is a Norgestrol is available in a 2 forms, Levo form and dextro form. Here you can see the Levo form. Okay. D means generally they will use a D-Norgestrol. L-Norgestrol. 2 are there. Here they are using a Norgestrol. Okay. Here they are using a D-Norgestrol. Okay. This is the dose. This is from your Tripathi textbook 0.3. See here 0.03 mg. Okay, ethyl estradiol and 30 mg, like that they are using in each pill, like that. Okay, doses not much important. Combined pill, every day orally they have to take at a night for a 21 days, from 5th day to 25th day. Mala N. Mala D, it consists of a daily you have to take. This is so 30 days, 28 days they have designed like that. 7-day break for Mala N. I told no 7 day. There is no ferrous fumarate in the Mala N, like that. During this, bleeding occurs, which is not menstrual bleeding, but it is so it is a mechanism of action. How these tablets will act, prevents the ovulation, prevents the implantation. All each and every step will be prevented. Okay. It makes the cervical secretions very thick, viscid, so that sperm cannot enter easily, because thick fluid will be there in the cervix, so that penetration of the sperm cannot be easily. Next is the sequential pills. Okay, It is a sequence. The name itself indicates it is also called as a phased pills. Sequential pill. High dose of estrogen. Estrogen is high dose. Moderate dose of the progesterone. This is the main thing. Dose, see here, estrogen 5 to 15th day estrogen. See, this is 5 to 15 days. 5 to 15, 5 to 15th day means 10 days. They have to take estrogen. Then both estrogen as well as a progesterone for the 5 days. Like that they have designed. And high incident of endometrial carcinoma. That is one of the biggest problem here. It leads to cancer, the sequential pill or phased pill. That's why they are not using. Incidence is more, incidence of carcinoma is more. Okay. And phased pills. This is also called as a phased pill because it consists of a 3 phases: monophasic, biphasic, triphasic. What is a monophasic? It consists of a constant dose of both estrogen as well as a progesterone. Both are there. Here, two different progesterone doses, progesterone only, available in a small dose and big dose. Then you can say it is a biphasic pill. Only one progesterone, here there is no estrogen. Whereas a first monophasic, constantly it is releases, constant, two hormones, constantly at a single fixed dose of both. That's why it is called a monophasic release, not one hormone, two hormones. Biphasic, one hormone, small dose, high dose. Triphasic gradually increase the dose of estrogen during the cycle. These 3 phases will be there here. Okay. 3 doses will be there, so that release rate is also there. Next we come to the mini pill. This is also called as a POP. That's why it is called a mini pill, because it consists of only progesterone. There is no estrogen. If it is there estrogen and progesterone, then you can say it is a combined pills. Here it is a mini pill. This is also called as a micro pill, also called as a only POP, progesterone only pill. It consists of only progesterone. Daily through whole menstrual cycle, you have to take it a daily, like this 28 days. See, example, for example, Sunday, Monday, Tuesday, you can take at any time. For example, today is Friday, you start here. This line you have to start. Because see the arrow mark, big arrow mark is there, no? For example, you started on Thursday. From here, you have to take like this. You have to follow like as per the arrow marks. And finally, you have to end with the on Wednesday, because Thursday you started. Okay. Makes the cervical mucosa very thick, decreases the motility of the fallopian tube, ovulation will be inhibited, prevent the fertility. These are the common of the. Okay. And it has been devised the elimination of estrogen. Here in this, we are not at all using the estrogen, because it is a long-term. Estrogen is very long-term risks are there. That's why they are not using the estrogen. Like that, they have prepared the nicely. A low-dose progesterone only pill is an alternative for women in whom estrogen is contraindicated. In some women, estrogen you should not give. In such a case, this is only the option. POP they have to. Okay. It is taken daily, continuously, without gap. 28 period, 28 cycles you have to take. Daily one tablet. The menstrual cycle tends to become irregular. That is a menstrual cycle will become, when it become irregular, automatically there is a no ovulation, nothing. Okay, this method is less popular. Mainly combined pill they are taking. And next pill is emergency pill. Emergency. Here what happened? They have to take within 72 hours of the unprotected intercourse. The wife has to take the tablet after sexual intercourse, which is unprotected. Okay, they are not using any methods for contraceptive methods, and within 72 hours they have to take a pill. That is called a emergency pill, also called as a post coital. Coital means sexual intercourse. Okay, women are not taking a contraceptive who had a sexual intercourse, risking in their unwanted pregnancy. Okay, this is called a, this is a post-coital pill mechanism. Within 72 hours, they have to take dose 2 combined pills immediately, followed by 2 pills after 12 hours. Indication only in emergency. Okay, contraceptive failure, unprotected sex, prevents the fertilization, and implantation by hypermotility of the fallopian tube and uterus. This is the main. How fertilization will be stopped, everything will be stopped if you are because hormones. No, this is the oral contraceptive pills advantage. It is 100% effectivity. See here, they are very happy. They prevented the pregnancy, but they have some disadvantages like a BP, hypertension. You can see this is a thromboembolism, formation of a blood clots in the blood vessels. That is one of the main problem. It may leads to heart attack also. Carcinogenic activity of the breast cancer. This is a symbol of breast cancer. That is also possibilities there because estrogen is mainly responsible for the breast cancer. Contraindications. These are the in these cases you can. So here I have mentioned what is thromboembolism, obstruction of a blood vessel by blood clot. This is the symbol of thromboembolism. And male pill. Even males also they can use. Okay, males. That is called a Gossypol. Popular, very important and very popular. Gossypol. Gossypol is a substance that is found in the cotton plant. See, this is a cotton plant. From this cotton is removed like this. From this seeds is removed. These are the cotton seeds, black. Cotton is white. Cotton seeds are the black. From this they extracted Gossypol. See, from the plant, seeds came. Seeds, the skin is removed, cotton is removed so that it becomes a black. These are pure seeds. From this they extracted the Gossypol. This is the substance. From this they prepared the tablet. This is a symbol of a male. They have to take in a arrow mark. They have to take. This is called a male pill or Gossypol. Right? They commonly used for the male pill. This is a Gossypol. This is mechanism of action. It causes azoospermia because your sperm count will become almost zero. That is called a azoospermia. Okay, exact action still not known to anybody. Gossypol, phenolic derivatives of cottonseed oil. Dose orally you have to take because we are studying only oral contraceptives. 200 mg per day, 2 months followed by a 60 mg per week. And disadvantage, permanent azoospermia after 6 months. If you are using it continuously for a period of 6 months, there is no spermatozoa production in the male. So he will become a unfertile. And one more thing is testosterone. See, testosterone is very important to create the sperm. But if you are using in excess quantity, if you are using, you will become again azoospermia. Oligospermia also. It is also called as oligospermia. 400 mg excess quantity you are taking orally, synthetic, see here, testosterone and decanate, soft gelatin capsules. Testosterone hormone is available. If you are taking it is in extra testosterone, it become a azoospermia like this. See, this is a normal sperm count and this is azoospermia. Okay, azoospermia is a medical condition of a man whose semen contains no sperm. And one more drug is also there, Cyproterone acetate. Related to, it is just like a progesterone. It is very potent anti-androgenic activity against the sexual organ. See here, Cyproterone. It is a brand name. Tablets are available. Cyproterone, 100 mg tablets available. This is also, it causes a oligospermia or azoospermia. Both are same almost. Causes a oligospermia and loss of libido. That is a sexual power. Will be okay. So I stopped my video here. Take a screenshots wherever you want. You have to take a screenshot. If you are not understanding, repeat the video and rewind the video.